Calcium channel blockers play a role in management of hypertension. We will start with its action. We already know the intracellular concentration of calcium maintain the tone of smooth muscle and contribute in contraction of myocardium. So as calcium channel antagonists or blockers, these drugs bind to L-type calcium channels of heart and smooth muscle of coronary and peripheral arterioles. They block the inward movement of calcium, altering the contraction mechanism and allowing the vascular smooth muscle to relax. It is important to note they act on arterioles mainly and do not dilate veins. Calcium channel blockers are divided into three classes: diphenylalkylamines, benzothiazepines, dihydropyridines, based on their properties. First, discussing diphenylalkylamines. The drug under this class is verapamil, which acts on both cardiac and vascular smooth muscle cells and is used to treat angina and supraventricular tachyarrhythmia. It is also used to prevent migraine, cluster headache, and treat atrial fibrillation. Second, we have benzothiazepines that include diltiazem. Similar to verapamil, it affects both cardiac and vascular smooth muscles. Is used to treat atrial fibrillation as well. But it has a less pronounced negative inotropic effect on heart. But the side effects associated with this drug are also less pronounced. Third, third we have dihydropyridines, which include drugs nifedipine, amlodipine, felodipine, isradipine, nicardipine, nizordipine. These drugs act on both vessel and heart, but have much greater affinity for vascular calcium channels. Now towards the uses, calcium channel blockers are used in treatment of hypertensive patients who have asthma, diabetes, peripheral vascular disease. They can be used as initial therapy or as an add-on therapy. Last, we have the adverse effects, which include, in case of verapamil, first degree atrioventricular block and constipation. Dizziness, headache, and fatigue are mainly associated with dihydropyridines along with peripheral edema. There are also cases of gingival hyperplasia. Verapamil and diltiazem should be avoided in patients with heart failure or atrioventricular block.